We've been here supporting sort of mental health and wellness for people since the evacuation and when people, the first responders. So we've been seeing a variety of people from first responders through to the return of residents and a variety of issues. Some of those are issues that would have presented prior to the fire. Some of those are things like stress, uncertainty, grief and loss, those sorts of issues. We've had 8,669 contacts since the evacuation. We have parents asking questions about how to talk to their children about the incident, about the fire, about the destruction or devastation that they see. We've had people coming that have been here for a while, working, and are they're emotionally tired. So looking for some strategies to manage stress. Certainly people in distress because of their loss. That's generally sort of what we're seeing. Everybody will respond to this or deal with this differently. We all have our own sort of experiences and ways of coping. So, it's hard to say who's more or less affected, and are we going to see more or less people at a certain time. We have a walk-in service that's available now 7 days a week from 8 in the morning till 11:15 at night, and we have enough staff to spend the time that people need. We have staff that will go out and support them. We have staff that will stay in the office. I think we're pretty well resourced to support the needs of the people presenting. We have this short-term strategy and certainly working in partnership with Alberta Health and the government to develop a longer-term strategy, because we know this isn't sort of going to be done and over with in a week or a month. This is an event that is outside of a normal experience, and so it's understandable to have reactions to that. Most people will manage those reactions with supports from their friends and family and resources. There may be people a small percentage of people that will develop some clinically significant symptoms. I mean, they could be a whole range of things. If people, after a period of weeks, if their sleep is interrupted, if that normal sort of day-to-day functioning is impaired, then I would encourage them to reach out to their physician, call our clinics, and sort of talk to us about those particular symptoms. My experience of Fort McMurray is certainly people are independent and resilient, and I haven't found that means they're not accessing the supports they need. Tough doesn't mean sort of, not vulnerable, and so I certainly have seen people recognizing their limitations and reaching out for those supports as they need to and knowing how to do that. Our services are located temporarily at 10721 Queen Street. It's a building behind the Rona hardware store. If you're not sure how to get there or our hours, please call us at 780-791-6194, and we're happy to give you those directions.